Okay, we're going to walk through what a sequestered disc is. Now, a sequestered disc is the most severe form of a herniated disc. Now, it's important to get a very thorough explanation of these because the explanation is more important than the pictures of them. So don't just go do a Google search or an AI search. We want to explain the process because the process gives hints on how to correct it. So we're going to look at this. So these are vertebral models. So these are the vertebra, obviously. In between the vertebra is an intervertebral disc. Now we're going to look at it in this shape. Now, there's two parts to the discs. There's the nucleus, obviously the center, and there are circumferential rings of tissue around the outside called the annulus. The annulus is filled with nerve receptors and pain receptors. So what happens is a person gets into an accident, injury, or trauma in the distant past, and the degenerative process starts. And it puts different forces into that spinal joint. And because it's getting different forces than what it was designed for, it starts down that degenerative pathway. So instead of the disc looking like this, over time, what happens is the nucleus inside starts to push through and starts to stretch and break the circumferential rings around the outside. Now, because these are so filled with pain receptors, it causes a lot of discomfort. And people start to seek care, or more dangerously, they just take painkillers or anti-inflammatories. So those are not fixing the problem, they're only addressing the symptoms. Now, if you don't get this corrected through care, it's going to get worse over time. So these disc bulges move over towards what's called a herniation. And a herniation can happen either at the side of the vertebra, where this disc material pushes back that affects the spinal nerve, but it can actually go backwards and actually hit the spinal cord itself. And that's where it's serious. So we always recommend to people, if you're having significant back pain, let's find out what the source of the issue is. Because if you have a disc bulge, it moves into a herniation unless it's corrected properly. Now, we have documented in-office X-ray evidence that shows that we can help correct these things. We can help pull this disc material back in towards the center of the disc. And the good thing about it is that medical research shows that the body can reabsorb these things, but it takes a long time. But it's important to reestablish the mechanics and the fluidity of that joint first. That's what spinal decompression helps with. We have very, very specific protocols we've developed over the past 20 plus years where we can actually help reverse these things, and we can prove it by digital imaging. Now, if you do not take care of this herniated discs, it moves into what's called a sequestered disc, where this piece actually breaks off and actually can go into the central canal, and that's where it is suggested where people get surgery. So we never want people to get to the part where it's a sequestered disc. Get it looked at in advance. But this goes back to a more important topic. If you're having any kind of back pain or radiating symptoms, or any kind of numbness, tingling, pins and needles anywhere, it's a neurological issue. And just because the pain may go away over a couple of days, it doesn't necessarily mean that the underlying mechanics are correct again. We always recommend people that have disc issues that they know of, any kind of radiating or referred pain, any kind of abnormal sensations, they get documented proof of what's going on. Don't just go and get anti-inflammatories or painkillers. Don't just go to physio and do some stretching. Find out what's going on there. Faith is for Sunday at church. We want to find out what fact is. So we go to great lengths to try to get people to understand what's going on. So we take in-office digital x-rays that measure down to 1/10 of a millimeter, and we have 2 state-of-the-art nerve scans that help us understand what's going on with your nervous system. It's a very thorough procedure. In fact, we're kind of a regional referral center for the orthopedic surgeon community. Burlington Spinal Decompression is the premier office, widely recognized throughout the profession and in the medical community. We hope we can help you. Please nose around the website, figure out if we're the office for you, and if you're having any of these problems, please consider coming in and seeing us. Thank you.